you?
I'm doing good. How about you?
Good. Doing good.
Are you guys nurses?
Yeah, we are.
You know, I'm not feeling very well. I have a headache and I'm really nauseous and I'm having some chest pain.
Oh, really? Okay. We're gonna go ahead and check your blood pressure. Let me see if anyone. Does anyone have anything to check the blood pressure?
Yes, I have a blood pressure cuff.
Oh, perfect. Can you check your blood pressure for us?
Yes, I can.
Do you have a history of hypertension or?
I don't know.
Okay.
Looks like your blood pressure is really high. We should have you get that checked out.
Okay, thank you.
Hello. So we did our presentation on hypertension, and this is going to be presented by Paul, Natalie, Jan, Grace, and Virginia. So my name is Virginia, and I'm going to be talking about what is hypertension. So hypertension is high blood pressure, or hypertension is when the force of the blood pushing on the blood vessel wall is too high. When someone has high blood pressure, the heart must pump harder. The arteries, which include the blood vessels that carry the blood away from the heart, are under greater strain as they carry blood. If you see in this picture below, you can see what a normal blood vessel looks like and what a narrow blood vessel looks like.
Hi guys, my name is Natalie. I'm going to be talking to you a little bit about some signs and symptoms associated with hypertension. But first, I just want to give a couple facts regarding hypertension. There's an estimated 1.28 billion adults from the ages 30 to 79 worldwide that have hypertension, yet an estimated 46% of adults with hypertension don't even know they have it. Less than half of adults with hypertension are diagnosed and treated. Now let's move on to the signs and symptoms. Some of the mild symptoms that can occur include early morning headaches, nosebleeds, irregular heart rhythms, vision changes, and ear buzzing. It is important to note that hypertension is often referred to as a silent killer. Because hypertension often has no warning signs or symptoms, the majority of people are unaware that they have it. As a result, it is critical to check blood pressure on a regular basis. Now, some of the more severe symptoms someone with hypertension might experience are fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. If you are experiencing any of these symptoms, please see your healthcare provider as soon as you can or call emergency services.
Hi, everyone. My name is Grace. I'm going to be talking about preventative measures for hypertension. So preventative measures for hypertension include a healthy diet, which reduces blood pressure. Specifically, a Mediterranean-style diet or DASH diet is recommended as it reduces sodium intake, emphasizes on fruits, vegetables, and less saturated fats. For many individuals, making these healthy changes can help keep blood pressure low and protect against other serious conditions such as heart disease and stroke. Maintaining a healthy weight, physical activity, and exercise and stress is also important, are also factors to consider because being overweight or obese increases the risk of high blood pressure. Thus, choosing healthy foods and obtaining regular physical activity are vital. It's recommended that adults get at least 2 hours and 30 minutes of moderate exercise, such as by walking or bicycling, every week to straighten the heart and lower stress. Next slide, please. Not smoking is another prevention. Smoking has been proven to raise blood pressure and puts individuals at higher risk for heart attack and stroke. Individuals should limit the amount of alcohol they intake because the more alcohol that's consumed, the risk for hypertension becomes greater. According to Mayo Clinic, men should have no more than 2 alcoholic drinks and women should have no more than 1 alcoholic drink per day as appropriate. And measuring blood pressure on a regular basis is a great way to maintain a healthy blood pressure, as hypertension often comes with no symptoms. This option may be done at home with a blood pressure monitor or at the doctor's office. Next slide. As for blood pressure medications, many individuals need to take medicine in addition to making healthy lifestyle changes to keep their blood pressure at healthy levels. A few medications may include diuretics, beta blockers, and ACE inhibitors. Diuretics help the body to get rid of excess salt and water in order to control blood pressure. If diuretics aren't enough to lower the blood pressure, a physician may recommend adding other blood pressure medications such as beta blockers or ACE inhibitors to the treatment plan. Individuals must take the medication as directed and let their physician know if concerns arise during treatment for an adjustment.
Hi, I'm Jan. I'm going to talk about complications from untreated high blood pressure. Uncontrolled high blood pressure causes complications to blood vessels. Excessive high blood pressure causes arteries to narrow, which will damage vessels and multiple organs in the body, such as the heart, brain, kidneys, and eyes. High blood pressure will cause thickening of the arteries, and the arteries also become hardened from an increase in LDL cholesterol plaque buildup. The hardening of vessels is known as atherosclerosis, which leads to complications including stroke or heart attack. On this next slide, the excess strain from high blood pressure causes coronary arteries serving the heart to slowly become narrowed from the plaque buildup, reducing blood flow, starving the muscles in the heart of oxygen, resulting in a heart attack. Another complication with the heart is when the heart has to pump blood against the high blood pressure in the vessels, causing the heart to have to work harder. The walls of the heart's pumping chamber will thicken, causing left ventricular hypertrophy, which will lead to heart failure. High blood pressure causes narrowing vessels and decreased blood flow to other parts of the body, damaging other organs like the kidneys, which causes kidney disease. Similar effects happen to the eyes. The decrease in blood flow to the retinas causes blurry vision and even vision loss due to the lack of oxygen to its cells. Arteries that supply oxygenated blood to the brain become blocked or even burst because of a stroke. On the next slide, other complications are aneurysms, which happen from a weakened artery wall that has ruptured. Could also get peripheral artery disease, which is a plaque buildup that leads to narrowed arteries in the legs, arms, stomach, and head. Also can cause sexual dysfunction. Penile vessels can become narrowed and decreases blood flow, causing erectile dysfunction in men. Thank you.
Hi, my name is Paul, and I will be discussing the prevalence of hypertension in San Joaquin County. In addition, I will also introduce a few community resources available to help with individuals with hypertension. Hypertension is a problem and statistically affects 45% of adults in the United States. It is more commonly seen in men compared to women. Broken down, it's 51% of men who suffer from hypertension compared to 39% of women who suffer from hypertension. Currently, 26% of Californians suffer from hypertension-related illness, and 30% of those people living in San Joaquin County suffer from hypertension-related illnesses. On the next slide, I will discuss the resources for individuals living with hypertension. Resources can be a valuable place to gather information and potentially reduce hypertension rates. First, I'll discuss the resources provided by the Health Plan of San Joaquin. There is a webinar available that discusses checking, changing, reducing your blood pressure. Anyone can access this information, making it readily available. The second one I'll discuss is resources provided by San Joaquin County Clinics and Kaiser Permanente. This resource is called Hypertension Management San Joaquin Clinics. Their mission is to prevent heart attacks and strokes. They focus on transforming cardiovascular care for the community. This is a great resource as well with valuable information. The last one is Measure Up, Pressure Down. This information gives you a lot of information about meal planning and different diets that you can take, and also offers you other community members who suffer from this disease. Next slide. And here are our resources for our slides. Thank you.